Hi guys, how are you? I hope you are all doing well. So today's my topic of discussion is about the frontal eye field area which is present in the frontal lobe. So guys, first I draw the structure of the brain and tell you the frontal eye field area. This is our brain. This is the central sulcus. Anterior to the central sulcus there is primary motor cortex. Anterior to primary motor cortex there is motor association cortex, which I discussed in previous lecture. You must see that lecture. And today's my topic of discussion is about this area, which is frontal eye field area, this green area. Today's my topic of discussion is this green area. This is frontal eye field. I draw some structures in the brainstem which are associated to frontal eye field. Here is some structure which I differentiate by the colors. Okay, so there are three structures in the brainstem, okay, which participate in the pathways of the frontal eye field, which is this area number 3. Okay, what are the name of these three structures? This is cranial nerve 3, which is oculomotor nerve. Okay, cranial nerve 3. This is abducens nerve, which is cranial nerve 6. Okay, and this is very important structure which participate in frontal eye field pathways. Later I tell you the all the pathways related to frontal eye field, which is very important, and about the damage of that area, what are the clinical disease occur. So this area is paramedian pontine reticular formation. Okay, paramedian pontine reticular formation. So this one and this one, all these structures are participate in frontal eye field pathways. So now I go to explain the pathways of the frontal eye field. I remove this and now I draw another diagram and label it. Okay, I have to compare both sides, right side of your brain and the left side of your brain, frontal eye field. Our topic of concern is frontal eye field. So this is frontal eye field of the right side and this is frontal eye field of the left side. Okay, second structure which I draw here is paramedian pontine reticular formation. From the right side, this is our right side, this is our left side. Okay, now I draw the structure of the cranial nerve 3, which is here, cranial nerve 3, and now cranial nerve 6. Okay, and I draw the respected eyes. This is right eye. Okay, and this is left eye. And I also draw the muscles. This is the medial rectus muscle, okay, in red color, and in green color this is lateral rectus muscle. Okay, so guys, I explain you the pathway okay, of the frontal eye field. So from the frontal eye field I draw the pathway. Okay, from the, this is frontal eye field, frontal eye field from the right side, okay, and this is from the left side, frontal eye field. Okay, I explain you one side, so the same mechanism occurs on the other side. So from the frontal eye field of the right side, send axon towards the opposite side of the paramedian pontine reticular formation. Okay, this is paramedian pontine reticular formation. Frontal eye field from the right side, send the axon towards the opposite left side paramedian pontine reticular formation. Okay, here is cranial nerve 6, okay, and here is cranial nerve 3. So cranial nerve 6, now this from the left side of the paramedian pontine reticular formation, it send the nerves same side cranial nerve 6, okay, same side from the left side. Frontal eye field send the axon to the opposite side of the paramedian pontine reticular formation. Okay, and now paramedian pontine reticular formation of the left side send the axon to the cranial nerve 6, which is abducens nerve. Okay, and now abducens nerve, what it do? Abducens nerve send the axon, guys, LR6 later rectus muscle is supplied by 6th cranial nerve, which is abducens, okay, of the same side. Later rectus muscle is innervate of the same side. Okay, now cranial nerve 6 abducens nerve send the axon to the later rectus muscle of the same side, but it participate in the opposite side of the cranial nerve 3. What are the name of the cranial nerve 3? Olfactory, optic, oculomotor. Oculomotor is the cranial nerve 3. Okay, so now cranial nerve 3 send the axon to this muscle, medial rectus muscle of the right side. So this is all the pathway. Okay, so frontal eye field, if frontal eye field is good, is functional, so its function is move the right eye medially, okay, in this direction because of the medial rectus muscle, and the left eye laterally because of lateral rectus muscle, okay, opposite side. Normally this is normal, but if there is a damage, now I talk about clinical. Okay, clinical, clinical. Okay, so now I talk about the clinical. When this pathway is damaged, what happen? In normally frontal eye field control the medial rectus muscle of the same side and lateral rectus muscle of the opposite side, left side. Okay, so the eyes move contralateral. Contralateral means opposite from the right side. Okay, right side field is this side. Okay, and eyes are moved opposite to it. This is normal. Okay, when there is a damage to this pathway, frontal eye field cannot control the opposite side of paramedian pontine reticular formation, so it also damage, it also not innervate. Now this pathway also cancel and this pathway also not innervate. Okay, so what's happen? The opposite muscle, which is this, the lateral rectus of the right side, pull the eye towards this direction. Okay, and also the same manner the opposite side lateral rectus muscle of the left side also not innervate due to damage of the nerve, so it also move towards the opposite to the normal. So it means the direction of the eyes is same as the frontal eye field. Frontal eye field, so frontal eye field damage, the direction of the eyes is same side towards the right side. Okay, if there is damage. So what are the name of this disease? Okay, name of this pathology related to that. Okay, the name of the disease is ipsilateral conjugate gaze deviation. What? Ipsilateral conjugate gaze deviation. Why ipsilateral? Because due to the right side of the frontal eye field damage, your eyes also move towards the right side. Okay, so the ipsilateral, same direction, that's why we name it ipsilateral conjugate gaze deviation. Okay, if it moves opposite side, then I use the word contralateral. Okay, it moves in the same direction, so ipsilateral conjugate gaze deviation, okay, is the clinical presentation of this type of patients whose frontal eye field damage. Okay guys, I hope you are understand this pathway very well. I explain it, and you must made the notes of this pathway. And in the next lecture I gonna explain you the prefrontal cortex, which is the most important structure area present in the frontal lobe very anteriorly. Okay, so today's my topic is frontal eye field. So I hope guys you understand this lecture. So please guys, please like, share and subscribe my channel, and please bell and also so goodbye guys.